Thank you all for coming in. My name is Karim Ahmad. I'm a director here at CHI. I've been at CHI for 6 years, going on 7, and I lead our Acclimate Colorado work, which is our body of work centered on protecting the health and well-being of Coloradans from a changing climate. I am joined by my colleague, Emily.
Hi, everyone. I'm Emily Santich. I'm a policy analyst at CHI. I have been here for a little over 2 years, and in the last year, a lot of my work is focused on climate and health. I also lead a lot of our assessment work at CHI, so I've had the opportunity to explore and analyze a lot of climate-related data.
Thank you for coming. Just to orient us on what we're going to get down into in this session, and welcome folks who are walking in right now. First, we're going to connect the dots on climate change and your work, the work that you are already doing. Second, we're going to hear from our friends from Kaiser Permanente of Colorado, and sort of how a health system has approached climate change and environmental stewardship, and how a community-based organization sort of grew into this work over time. And finally, we're going to do something called a fishbowl. So there's a reason why there are 4 chairs in the front of the room here. This kind of looks arbitrary. It's not a mess, although rolly chairs in a room at a conference is kind of interesting. So thank you for bearing with us. But Emily's gonna facilitate a fishbowl activity. It's going to be an engaged discussion, and she'll walk us through that in just a moment. So there are 3 things that you take away from our conversation today. One, you heard it earlier today from Jeff's presentation. Climate change is impacting the health of Coloradans today, but they don't necessarily feel prepared to deal with those impacts. Second, climate resilience. Ooh, super loud. Climate resilience and social factors that influence health go hand in hand. And when we say climate resilience, what we really mean is a community's ability and capacity to rebound in the event of a climate event, like a wildfire. Of You heard the statistic earlier today, but nearly 2 million Coloradans report that they believe climate change is impacting their health now. And we're just beginning to sort of understand what that means. We're just beginning to sort of understand this data. We've just sort of reviewed it here in this last week. But what we can say is nearly 2 million Coloradans in the last year report either they themselves or their families have felt health impacts from climate change, with two health impacts rising to the top. I'm curious, for a raffle ticket, can anyone guess what those 2 health impacts are? 1 raffle ticket per guess. That is the number 1 health impact, actually. So Megan, thank you. You said respiratory issues, breathing, asthma, COPD, things related to breathing. Any guesses on the second one? Mental health. Mental health. Those are the top 2. Very well done, Stephanie. So yeah, while sort of we're unpacking these data and sort of understanding the health impacts, it's really important to sort of note that this is our first take at the data and our first understanding of the data, and each one of these categories is very nuanced, and understanding how those health factors play out, it's important to engage with community to really understand how that's playing out. But those are the top 2 that we're seeing right now. So again, nearly 2 million people reporting climate change. They believe climate change is impacting their health. But do they feel prepared? Well, we heard this morning that not so many Coloradans feel prepared. 18%, in fact, believe that their community is well prepared or very well prepared. So why does this matter? We have a huge chunk of society saying that this is connected to their health. They believe that it's impacting their health. But we don't have a lot of people saying that they feel prepared. So there's an opportunity here. And we want to have a discussion today about sort of how that can play out. Climate change is a health equity issue. I'm sure you've heard this if you've ever been to a climate change presentation. But what that really means is climate change is impacting the health of Coloradans today. Some communities more than others, including older adults, some communities of color, people who are lower income, people don't have access to resources, people don't have access to cooling, things like that. And climate adaptation, taking steps toward climate resilience and climate adaptation is really an opportunity to protect the health of your communities. And there's a role for all of you to play in that. So again, if you haven't had a chance to scan this QR code, I know we have like 10 minutes of tech issues with these. I think everyone did at this point, but I'm going to leave this up on the screen for just a moment again. It's going to prompt you and ask you, we want to understand sort of what are the roles that you play in your organizations? What are sort of the key areas and bodies of work that you lead in your communities? That'll really help us understand how to guide our discussion today, because there's a role for any kind of work in the climate resilience space. So feel free to give me a thumbs up. Stephanie, you good to go? Cool. Anyone else? Awesome. All right. Well, all right. Awesome. It worked. It worked, Emily. It wasn't working before the session. So it looks like we have folks from all sorts of areas. People who are working in the built environment, lots of folks in healthcare, hot issues in health, so not a surprise. People who are working in community health, economic stability, food security. I'm curious, who's working in built environment? Megan, a little bit. Cool. Nice. Well, the point that we really want to make here is whether you're working in the built environment or you're working in direct healthcare or you work in housing or policy or public health, there is a role for you to play in climate resilience. And to that point that I was making before, actually, the second takeaway, climate resilience and social factors go hand in hand. This is really sort of at the heart of this presentation. What is the connection? What does that really mean? Well, social factors that influence health, so work that you'd be leading in built environment work you'd be leading in healthcare, making sure that people have access to the things that they need to lead happy, healthy lives. Those social factors that influence health are really protective factors against climate change. So if you're working in housing, you're ensuring that people have access to a roof over their heads and they're protected from the elements. You're working in food security, you're ensuring that people have access to nutritious food, which ensures their physical health. It ensures that they are leading a happy, healthy life. And then if you're working in healthcare or mental health, ensuring sort of that continuity of care in the event of a climate disaster, the event of a wildfire happening. We've seen this happen time and time again in Colorado. Ensuring that continuity of care is important. And of course, access to good jobs, access to money, ensuring that your communities have access to the resources that they need to ensure that their communities are prepared in the event that a climate event happens is another one of those social factors. So to hear a little bit more about how a health system has really dove into this work and how Kaiser Permanente, Lisa's going to dive into this in just a moment, how this work is really connected. I'm going to pass it off to Lisa to share a few thoughts.
Okay, I do need to juggle my water and my notes. All right. Thank you, Karam. Thank you, Emily. I just want to also thank CHI for the opportunity to be here today and tell you a little bit about the work that we do at Kaiser Permanente. As Karam mentioned, my name is Lisa Romero, and I'm a senior community health specialist on our community health team. And our team is the department that manages all of our philanthropic investments and the support we provide in communities to address the social and environmental factors that really contribute to the health of our community. Specifically about the environmental stewardship component of that work. And I'm going to share a bit about how we work to address our environmental footprint as an organization, how we really extend those efforts beyond our four walls, and how community voice and community input has really helped shape those the approaches we take in those spaces. But a bit about my background and the lens that I bring to this work first. So I have a clinical background. I'm a physician assistant by training. And I started my career in Commerce City, Colorado, which is a location that we know is very environmentally burdened, a lot of pollution concerns. And my role in taking care of patients and families in that space really made me witness to some of the concerns and challenges that people face when trying to get healthy and stay healthy and protect themselves in that environment. And so really from the early days of my work there, I was inspired to try to do more to work upstream and foster healthier environments and foster healthier communities. So it's a perspective and a passion that I really bring to my work here at Kaiser Permanente. But moving back to Kaiser Permanente as an organization, as you know, we are a large nonprofit health system. We work in 8 regions, including Colorado. And much of our environmental stewardship work really has been conducted at that national stage and really has had a focus on our environmental impact as an organization and the impact that our operations as a care provider have in our communities. So for many years, we've had a lot of work happening to reduce our greenhouse gas emissions, to address our energy usage, and, you know, look at things like our water use intensity, our waste that we're generating, and establishing environmentally responsible purchasing policies and things of that nature. And it really has established us as a leader in healthcare sustainability. We were the first U.S. health system to achieve carbon neutral status in 2020, and we're continuing work towards our goal of 50% emissions reductions by 2030 and net zero by 2050. But one fairly unique aspect of our environmental stewardship work, even on our own footprint, is that it's housed under the larger umbrella of all of our community health work. So we think of this work alongside our efforts to address access to care and housing and food security. And it's not work that is part of a facilities team or part of an independent sustainability team. And not that there's anything incorrect about that approach. But what this did for us is it really fostered a focus on environmental stewardship framed based on the health benefits that it provided for our communities. And knowing that reducing out any sort of pollution or impact on the environment, again, fostered healthier environments. And that inspired us really to think about how we move outside of our own operations and beyond our 4 walls to think about driving change in the healthcare industry more broadly. So healthcare, we know, is a very energy intensive industry. There's a broad impact that it has as a sector. You know, it's responsible for 8 to 10% of the greenhouse gas emissions in the United States. So we knew that if we could share our best practices and really disseminate these changes across the sector, our impact could really be magnitude greater. And so we've worked with organizations like the National Academy of Medicine, Healthcare Without Harm, and i2023 to really drive collaborative action around healthcare decarbonization and efforts to make supply chains more environmentally responsible and efforts of that nature. But I think, you know, even beyond that, you know, even if we think about beyond the healthcare sector, having environmental stewardship as part of our community health umbrella positioned the work so that it was actually informed by the community voice as well. So all of our community health investments are informed by our community health needs assessment that we complete every 3 years. And so we've seen in doing that process that climate and environment has started to really rise towards the top of the list for our communities as far as factors that are impacting their health and concerns that they have about climate change, pollution, extreme heat, issues of that nature, and how we need to address those issues and build resilience to those threats to really achieve you know, the best health possible. So seeing climate and environment emerge on our CHNA Community Health Needs Assessment, CHNA, really inspired us to think of this as it's a bit of an emerging space for us in community. And so we, in 2022, 2023, recognized the need to understand this issue even deeper. And we worked with CHI to produce the report you see here on the screen. So we really wanted to take a deeper dive and understand beyond the issues that emerged in our CHNA, which really were focused on air pollution and heat as concerns, we wanted to know more. We wanted to really understand how can Kaiser Permanente show up as a health system in a meaningful way in this space. And so this report was really an important step and tool for understanding just that. And I don't have time, unfortunately, or maybe fortunately for all of you, I don't know, but I don't have time to go through all of the details, but I will share just a little bit about some of the themes that emerged. And one really prominent theme was education. Education about climate as a health issue, and not just of our patients, but of our clinicians and of our community members as well. And so we've, in the last year, launched a climate events page on kp.org. I think they'll drop the link in the chat, but it's kp.org/climate events. And it does just that. It explains to patients and community members what are the environmental threats that are happening in our communities now, how does it impact health, and how can you protect yourself and your family. And again, we also saw an emerging, a consistent theme about the need to protect ourselves against air pollution and heat. And an example of work we've done in that space is in the last year, we provided support for Downtown Denver Partnership's Urban Tree Canopy Initiative. So really looking at some of the parts of Denver as a city where tree canopy is really inadequate, and by supporting that and fostering a healthier, broader tree canopy, we can make those neighborhoods more resilient to extreme heat and air pollution. So I could go on for a very long time. Those of you who know me know I'm not very concise, but I hope that by sharing a little bit about kind of our background in looking at our own footprint and how we thought through moving into community, that it's given you a little bit of a sense of our work in environmental stewardship, and maybe can help other people and other entities who are thinking of how they can meaningfully get involved, to be kind of give them some inspiration or ideas. So with that, I will hand things off to Guadalupe Solis from Cultivando to hear about their wonderful work.
Hi, everyone. Good afternoon. This is very loud. As Lisa said, my name is Guadalupe Solis. I'm the Director of Environmental Justice Programs at Cultivando. In my role, I focus on building power and leadership within our communities in Commerce City and North Denver, mostly by growing our knowledge and our leadership on environmental policies, laws, processes that really impact us. Through my work at Cultivando, I also consistently find work and opportunities to bring resources to our communities to implement the projects, the actions, etc., that are needed. And so first and foremost, Cultivando is an organization that is led by Indigenous and Latina women. Some of them are here in the audience today, and we all live and identify as part of the communities that we serve. And so that is our superpower. It allows us to see really the gaps, but also the strengths in achieving our mission of health equity and building leadership within our communities. We respond, and we like to say that we respond at the speed of community need, which means moving fast to find opportunities to expand our reach on topics that the community identifies as important. In the past and present, we focus on topics very much related to health equity, so promoting early childhood education, strengthening our community in-home childcare provider network, and most recently, maybe not recent, but in our memories, responding to the COVID-19 pandemic, as our community were the ones that were most impacted by this disease, as the data show. And so the way that we actually made it into climate and environmental work was from a Keystone event that happened in 2019, and we call it Keystone because during this event, the Suncor oil and gas refinery that is located in between North Denver and Commerce City released a cloud of yellow clay-like substance and also hydrogen sulfide air pollution into the atmosphere in Commerce City and North Denver. And so what turned this event in 2019 into a Keystone event, because this wasn't the first time that there had been an event like this, an exposure event, and a fire, or even an explosion, but this was a Keystone event because instead of offering a response and action focused on public health and safety, Suncor offered free car washes to the communities that were in the vicinity of the event, right? And so, deservedly so, that built up a lot of momentum and a lot of interest also in the community, right? On top of that, even prior to 2019, our promotoras had continued to hear, right, anguish complaints of bloody noses, severe migraines, nausea, even miscarriages among pregnant people in the community. And these were occurring at significantly higher rates than communities 10 miles out from the refinery or even 5 miles out from the refinery. Also, the week that this event happened in 2019, our promotoras received a flood of questions from concerned parents and other individuals in the community about what this clay-like substance was, right? What could be done to protect families and individuals from it. And we quickly realized that we were also in the dark because information, right, risk-reducing health protection information wasn't being released in real time and in a way that could be understood by our community. Turn my page here. And so in the midst of all of this, it became very clear that this environmental issue was a health equity issue, as Karam and presenters here shared, because exposure to toxic air and the subsequent health impacts from it were most impacting our communities who are predominantly lower income, Spanish-speaking, and majority people of color in Commerce City and North Denver. And we see these trends around the country, refineries, waste storage facilities, all of that being built next to these communities. Also, we saw these impacts in the educational, the health, and other incomes within our communities, and we continue to see those today. And so thanks to the focus and dedication of our executive director and also of our team, we brought this need to our board after this event, and the board unanimously voted to approve of Cultivando applying for a $1.8 million supplemental environmental project grant to help implement the state's first community-led air monitoring project. So we were able to do all of that. Aside from the air monitoring component, we are also documenting the impact that consistent exposure to air monitoring has on people's health, as well as the social and emotional impacts that the presence of an oil and gas refinery has on the community members living in that area. And right, of course, the physical health impacts, increased rates of asthma, of all of the different things that I just mentioned. It's important to consider that not just as a one-time exposure, but people being exposed over their lifetime, right? Living for years and decades in Commerce City. And one of the most important reasons as to why Cultivando also brought in our focus into environmental and climate work was the importance of doing our best to ensure that those who experience the negative impacts of air pollution are also having the best resources and opportunities to have a direct impact, a direct say on the collection of the data, how the data is going to be used, to move action, to inform policy, to inform next steps. And so we were able to expand on this work through our youth programming, where youth learn about the environment, but are also given the tools, the leadership to address these very environmental issues that are occurring in their communities. Also, during our SEP, our Supplemental Environmental Project, our team of promotoras deployed over 50 different SUMA canisters to individual community members and even more purple air monitors, and also filters into the community. Again, emphasizing that community members can collect this data and can have a say in how this data is used and is implemented. Through our work, we have also challenged the norm of what is seen as legitimate research through academic, scientific, and policy-making audiences by spreading awareness that community-derived data and information is just as valid and should not be discounted. When there is a will, there is a way, and when there is love for community, all is possible. And again, I say this because our team and community did this all in the middle of a pandemic, with so many other pressing and intersectional issues rising to the surface, right? So you could imagine the work that it took, and the passion and the drive and the motivation. So lastly, what started off as a pilot program at Cultivando through the SEP has now become a permanent program, and within our work, we don't plan to stop anytime soon, focusing on environmental justice until the communities in Commerce City and North Denver see the accountability and the responsibility that they've been waiting for from Suncor and from other polluters as well. And so, again, this is our story about how traditional health equity-based organizations realize that climate work and environmental justice work are very much tied to health equity. If anything, they go hand in hand. And people can't be healthy, they can't thrive without a good environment. So yeah, I think that's it. Thank you, and I think I'll pass it on to Emily.
Guadalupe, thank you so much. I'll invite the three of you, Cara, Lisa, and Guadalupe, if you want to take a seat in one of the 4 chairs. We're going to transition into an activity where we'll get to hear from folks in our audience. So thank you again so much, Lisa and Guadalupe. Really inspiring to hear your stories and hear about how your organizations have gotten more involved in environmental stewardship, environmental justice, and really centering it with what community needs and responding to that with both of your organizations. So really appreciate you sharing that with us. So has anyone here participated in a fishbowl activity before? Raise your hand if you've done this. Okay. So a lot of folks, this will be new, so that's great. So I'll spend a little bit of time walking through how this is going to work. So our participants for the fishbowl are going to be in one of these 4 chairs, and our team has come up with a couple of questions for discussion today. So Cara, Guadalupe, Lisa, and whomever would like to join us first will be responding to our questions, and everyone else who is sitting in the audience, you will observe and listen to the conversation. And think about the questions and comments that you have, because you will have an opportunity when you would like to tap in and join the fishbowl. So if you are sitting in the audience and you would like to come join us, you can come up to one of the 4 seats and tap them on the shoulder, and you will swap places so you can come join the conversation, and Lisa will take a seat in the audience. And this rotation can happen at any time, so you don't have to wait until I go on to the next question. We encourage you to jump in as soon as you would like to, and we will be offering raffle tickets for folks who come join us. So added incentive if you weren't already excited about joining us up here. And we won't be doing a traditional Q&A, so if you do have questions for either of our presenters, if you have questions for Team CHI, if you want to bring your own question for discussion into the fishbowl, we certainly welcome that. So come bring your questions or comments. And finally, for folks who are joining us virtually, please enter any questions or comments that you have in the chat, and we will be able to monitor those and kind of relay what's happening online to everyone in the room. And Cara will be tracking what that conversation looks like. So before I move on to our first question, any questions for me about how this activity is going to run? Okay. Well, we will start with our first question, and I would invite whoever would like to come join us. Stephanie, are you joining the fishbowl? Wonderful. Great. And when we can, we will get you a raffle ticket. 16 raffle tickets. That's fair for being the first person. Okay, so our first question for discussion is, we would love to just hear a little bit more about your work or your organization's work, and in what ways you're impacting the health and well-being of communities or those that you serve. So it doesn't have to be immediately related to climate or resilience or adaptation. We really just want to get kind of a general sense for what your organization does and how you're impacting those that you serve.
My name is Stephanie Salazar Rodriguez, and I'm the owner and lead trainer of Blazing Cloud Consulting. It is a small public health training and technical assistance business. What I do is I do lots of different training in different topics in public health. I'm working on substance misuse, education, prevention, Narcan distribution. I'm also working with CHI on a project. I work with AgeWave Colorado, working with seniors, and I work with Colorado Blueprint and Hunger. So I'm really looking at a lot of different topics having to do with public health, from food insecurity, substance misuse, community engagement, and really trying to find ways to mobilize our communities and to really be able to amplify the voices of the people in the community who are doing the work.
I touched a little bit about this, or on this rather, when I was talking earlier, but at Kaiser Permanente, within our community health strategies, we support efforts to address many different social determinants of health and environmental determinants of health. And as Karan mentioned, issues like access to safe housing and access to healthy foods really are part of the overall climate resilience picture as well. And so I'll just elaborate a little bit on what we do support in communities. So we have our access to care and our safety net support program area. We support food as medicine and nutrition security, an area of work called Housing for Health. And then we also support economic opportunity for our communities to make sure that people do have, the ability to, and agency to kind of meet the needs that they have. And then we do work in schools. A lot recently has been centered on mental health, both for students, staff, and teachers. And, we have kind of the ability to kind of meet emerging needs as well within our market. So it really is, I think, when we start framing community resilience as meeting this broad system of needs, it's really pretty easy to start connecting the dots between those efforts and overall community resilience.
Thank you. I think one of the ways that we are creating an impact or having an impact on people's health and well-being at Cultivando, one of our main missions or visions is creating sustainable leadership within communities. And so the way that we've been doing that recently, both in environmental justice and even beyond, right, is really bringing community members to the decision-making table. Having community members meet with the Attorney General, talk about substance misuse among youth, about childcare needs, about early childhood education needs, what our promotoras in community are hearing, right? But also having community members show up to commissioner meetings, having commissioners come to Commerce City to talk about the issues that are most pressing to them, and really, giving community members the autonomy to identify these are the issues that we want to talk about, these are the issues that are top of mind for us, and how can you, as commissioners serving the public, really work with us, right, to collaborate on strategies, on next steps, etc. And so I think that, again, through sustainable leadership, giving community members the expertise, the tools, the knowledge building, technical assistance, right, to be able to have these conversations and advocate for their needs is a way that we, again, right, are creating meaning and change for health and well-being in our community, because only community members, only those living the experiences, right, know what issues are most important to them and what solutions are needed. So.
Yeah, I'm happy to share a little bit about, I mentioned our Acclimate Colorado program. If you all are not familiar with the Acclimate Colorado program at CHI, it is, again, our program centered on protecting the health and well-being of folks from climate change in our state. We like to say there are 3 A's in the Acclimate program. The first A is assessment. So we do a lot of research, a lot of sense making, a lot of sort of making sense of a very complex, multifaceted issue. So you see the data that we have from the TAG, you see our reports, you see some of the work that we do related to that. The second A is alignment. So there's a lot of folks in the climate space, in the environment space, in the social factors, social needs spaces, people who are working the state level, the local level, a variety of different areas, who in many cases are doing similar bodies of work. They might be stepping on each other's toes. Resources are not necessarily being used effectively. So we do a lot of alignment. Second A is alignment. We have something called the Acclimate Colorado Action Team. And actually in that action team, we convene around 24 different organizations, folks from local public health systems. These two are part of the action team, actually. And I have a plug-in later in the presentation if anyone is interested in joining. Megan, you participate in some of those conversations as well. Healthy Air and Water Colorado participates. So we do a lot of that alignment because it's important to have those conversations. It's important to have that transparency and that information sharing across organizations. And then finally, the third A is advancement and assistance. A lot of organizations have like a climate person. That's not enough, right? It's not enough to think that one person has to do the data, has to do the sense making, has to raise the money for the organization. It has to do the community engagement. I'm looking at Guadalupe. You know, you're doing a lot of work at Cultivando. It can be a lot for smaller organizations, especially. So we try to provide technical assistance to different groups in the sort of capacity of data research, convening, alignment, and sense making wherever we can. Yeah.
Thank you, everyone. Let's get a few other folks to share what you're working on and the ways that you're impacting communities. I welcome you to come tap any of us out at any time and share about your experience and those that you're serving. Thank you, Amanda.
My name is Amanda Kim. I'm with the Center for Improving Value in Healthcare, and we administer the state's all-payer claims database for the state of Colorado. So this is a database that collects claims from Medicaid, commercial insurance, Medicare, and we're able to use that to do analytics and public reporting on healthcare utilization, access, and support community members and organizations who are trying to understand different aspects of the utilization policy decisions. What's the impact of policy decisions? Have we seen the impact that was intended? We've provided data to Cultivando related to respiratory illnesses. And so in addition to using the claims data, we've also started integrating social determinants of health data from the American Community Survey and other public surveys that allows us to layer in this information and look at the correlation or relationship between these different social determinants, whether somebody has access to transportation, what somebody's housing security, and how that relates to health events. And so we're really excited. We have a lot of public reporting that's available in addition on our website, in addition to the support that we can provide to organizations directly. But we also have a new evaluation team, research and evaluation team that has started over the last few months that can provide supports to organizations that don't have that capacity to do some of that evaluation work using both the claims data as well as other data sources to help bridge some of these gaps in understanding and the technical expertise that's required to use some of these big data sources is something that we're able to provide to communities in Colorado as well.
Yeah, thank you, Amanda, for sharing that. That's so needed to have organizations that might be higher capacity who can support folks on the ground who are really essential for building trust with communities. They are parts of the communities that they're serving and they understand the need really on the ground. So to be able to support organizations to help them do what they need and provide that information is super impactful. So thank you, Amanda, for sharing. I'm going to move us on to our next question. And again, as folks want to join our conversation, please do. So we'd like to hear, in what ways are you or is your organization already making communities more resilient to climate change? So we did a mentee activity while Karim was presenting, and we saw that folks are working on built environment, they're working in public health, they're working to advance community health, public policy, philanthropy. Folks in this room are already impacting communities in so many ways. And how are you currently kind of connecting the dots between the work that you're doing and building a community's capacity to really respond to and adapt to climate change?
Some of the work that I do are in some extremely high needs and under-resourced communities, primarily in Southwest Denver. I work in a community that's called Westwood, and it's one of the most forgotten neighborhoods in addition to Swansea area, yes, okay. And so we don't have, we have areas where we don't have sidewalks, we don't have a community recreation center. They broke ground on one. Now we are in 2023, and other communities around us have had these types of facilities for decades. And so they just broke ground on this. And so we don't have a lot of, we're in a food desert. We have a lot of cannabis dispensaries, a lot of liquor stores, a lot of fast food restaurants, and not a lot of opportunity for person and other people in the community to bring awareness on the opportunities that they have to be able to voice their opinion and to give input on the kinds of things that they think that we need in the neighborhood. So we're really working on those types of things. We have the shot spotter, and you guys know what a shot spotter is? Anybody? Somebody does. Okay. There's 3 in the metro area right now. One of them is in Westwood. It is what the police department uses to track gunshots. And they just do it in the highest neighborhoods that have gun violence and gunshots. And that is one of them is in Westwood. So we have a lot of violence there. And so we just really want to make sure that my organization, as much as we can, to really bring some of those things to the attention of community and the community leaders. I've been really involved with the District 4 Police Department on crime reduction. And so, and some of that, I mean, we're looking at built environment, and so climate in general, I would have to say it's not quite as impactful, but looking at some of the things that lead to those. When I first started my master's in public health at UC Anschutz, I took a course about built environment, and when I walked in the room, I was like, why am I here? How does it have, what does that have to do with public health? And within about 5 minutes, I'm like, duh. And so it just really gave me a different mindset and framework on trying to work in community and to see how important that is. And when we all live in a concrete jungle, I mean, we have the capacity of having so much less, what did you call this, the shade trees? They talked about that as the canopies, and we don't have those in our neighborhoods. And so I think those things are really important as we're looking at the built environment. And like I said earlier, the communities I primarily work on, the Latino and Native American communities.
Thank you. That's really helpful. Thank you for doing that. My name is Megan. I work with Healthy Air and Water Colorado. We are a nonprofit organization. Our bread and butter really is the advocacy work, but my role as advocacy director is to work directly with health professionals across our state, as they are some of the most trusted sources of credible information on climate change. They have that interface with their patients, which is so critical to make sure that our community members are receiving that information on how to safely, excuse me, in light of extreme heat events and other extreme weather events from their doctors. But also my role is to train health professionals to engage in the public policy process. Our organization really focuses mostly on statewide policy as it comes to climate action. And I can tell you that this year our focus will be on making our communities more resilient to things like extreme heat and the ozone crisis here in the Front Range. And the health professional voice is really critical for decision makers to hear as well as their patients. So I just want to emphasize that that is a key avenue to pursue. And excuse me, we also this past summer, yes, it was just this last year, we issued and published a report on extreme heat in Denver's most heat vulnerable communities. And we were meeting with local decision makers, and this has also helped inform us with some statewide policy that we're bringing this coming session.
Thank you. Yeah, I mean, I think in terms of making our communities more resilient, I touched a little bit on that in my previous response, right? But again, it's just providing the resources and the capacity, the technical assistance for community members to voice their needs. But also, I think, you know, it's within our work very much focused on the Suncor oil and gas refinery and the various permits, the various laws, the various acts, right, that govern or regulate this oil and gas refinery. It's been very important for not only us as Cultivando to understand these different laws and policies and as they're happening and why they're happening and what does it mean for our community, but then also getting that information back. So that way, right, as you both just described, so that people who are being impacted can advocate, right, for better laws and policies. So that's one way, but I think another way too is through ensuring that we get real-time, reliable meaningful information to our communities when these exposure events occur. And so, talking about an emergency alert system, I mean, there are various emergency alert systems that exist that come from Suncor, that come from the state health department, even local health departments. But time and time again, we've been told that these alert systems don't make sense, they're not timely, and most importantly, they're missing two key components. The first component is, okay, so there's been this exposure event. Should you go inside? Should you avoid the water? Should you, what health promoting or risk reducing behavior should you take? Number one, but then number two, right, as you are, what are the opportunities to make your voice heard, right? If you're a parent who's consistently having to take their kids inside and not allow them to play in the playground, right, be healthy, or vice versa, what are the actions, rulemaking, open sessions, right, that you can attend? Who can you contact? What can you say to make your voice heard? And so those are ways that we've also been thinking about making our communities resilient. And even then, right, I think also in our community, we don't want to just accept the fact that this oil and gas refinery is here. We want to look at a future beyond that. And so how can we be resilient, but then also not just adapt or not just mitigate, right? Those things are important, but it doesn't end there. And so
I want to pause and see if anyone online had any contributions, questions. Looks like nothing
Not
so
yet.
far. Cool. We can move to the next question.
And what both of you shared too, I'll just share in our work with Lisa and with Kaiser Permanente, advocacy and leadership was such a huge piece of what is needed more in this space, as well as education. So thank you both for the work that you're doing to really elevate voices and build our state's capacity to really advocate and lead on these. So thank you. So we've talked a little bit about the work that you're already doing, and this work is not without challenges and without some barriers. So we want to get into those and really understand what are some of the things that are going to be in the way of you either getting into this work, being impactful in this space, being very visible in this space. What are some of those challenges and how have you experienced those?
I can get us started. I know like the everyone's gonna say resources and access to sort of, resources, period. Exactly. That's one thing. From the CHI perspective, I think something that can be difficult, and a question that often comes up a lot is sort of having access, and Guadalupe just touched on this, having access to lifetime data, having access to being able to connect X environmental factor to X health outcome. We're getting better and better at that. We're getting better and better access to data from a variety of sources. Civic has access to claims data, which is great to hear that that's being shared with organizations like Cultivando. I'd love to see more and more partnerships like that. Like, I think that's pivotal in this space, is especially in cases where we have some of these events, like the Marshall Fire, for example. We're just beginning to sort of understand the after impacts and effect, the environmental impacts. Case in point, like 1,000 homes were burned in a matter of hours in the Marshall Fire 2 or so years ago, on the dot almost. And the sort of physical, environmental, health impacts are just beginning to be understood after that. So having that access, being able to draw those connections, I think is absolutely important. I'm not going to rant on data for any longer. I want to see if anyone else has any thoughts.
Something I hear from the health professionals they work with is they feel like it's a huge barrier to get involved. Hi, Lisa. Climate change. So both action to mitigate our emissions and limit our carbon footprint and lower other emissions across the board that are exacerbating the climate problem and impacting people's health. And we're seeing overall not enough action to help communities adapt and build that resiliency. So something we have been building out within our organization is trying to elect more champions of climate and health. That's something we need to see a lot more of. We need those people within our decision-making bodies to really become those people to step up and really push for these changes, because we're hearing more and more from communities that they're just feeling just so disenfranchised and discouraged, and they're getting tired of feeling neglected over and over again. And we really need to be making sure that we're seeing more representation within our decision makers. And so we're actually able to actualize a lot of these mitigation and resiliency policies that we need.
For me, in the communities that I serve, I think one of the greatest challenges is awareness and leadership. I think that many people think that communities of color don't really care about changing climate and or even emissions. And you know, there's an organization called Green Latinos, and they've been really stepping up to the plate and doing a lot of work and really getting education out to the community. But I think even more than that, as Carmen said, was resources. Without resources, coming to smaller organizations, community-based organizations, you know, how can they do the work? You know, they're fighting every day to keep their head above water, but if they don't have any additional funding to move forward in climate, they're looking at other areas. So I think as we look at resources, we really try to make sure that those organizations that have typically not done that work, who are interested in it, give them an opportunity to have resources and to go into their communities and train their people and do what they're doing in Commerce City. My brother lived there for many years, and they called it Cosmic City. And so, you know, nothing has changed over, probably even gotten worse in the last 40 years. And so I think, you know, we just really need to bring those resources and allow community to make some of those decisions and put them in leadership roles, so then they can, where did you go? Where'd you go? Oh, and be part of policy and making those decisions as we're working with policymakers.
Hi, my name is Melina Castaneda, and I'm with the Colorado Law and Policy. And I would say within the last year, we have dived further into environmental justice, especially since we are a great big focus within healthcare justice. And a big thing that we've learned in our research and our learning time is there is issues in ensuring that all communities are involved, and the solutions are being proposed are for more middle upper class economic status and not lower income and underserved populations. And so we're noticing a lot of that issues, and the solutions are not equitable in any senses that we're having right now. And we need to look into more, how do we not only include the voices of the community more, but how do we come up with solutions that they want to spearhead, that they want to be able to show up and testify and be a witness at the Capitol and say, this is the solution we've been asking for. And same thing for more rural areas. We can go into more electrical vehicles, more transportation in that way, but farming is doesn't have any solutions in changing how they work. And so also looking into how do we meet everyone halfway rather than to tell them to come to our side. That's what I'm seeing, a lot of barriers and challenges we're seeing within our own research.
Good afternoon, I'm Laura Martinez, Manager of Environmental Justice Programs at Cultivando, and some of the challenges that we face are not only within the resources, but also with entities that are built to support us. As you have previously mentioned, especially with us, the state agencies such as CDPHE, or federal agencies such as EPA, where we have the results, we have the data to show that the effects that our community are facing because of environmental factors are negatively impacting them in their health. But we also have, like you have mentioned, Melina, in terms of resources, we have a lot of community or other organizations come and telling us that we have resources for you, such as electric vehicles, and we have discounts. But even with those incentives, it is not enough for our community to take advantage of, because they don't have the capacity or they don't have the resources to afford maybe they're already struggling with their power, with their energy, and then to have an electric vehicle that just requires more energy, which they may or may not have the next month. So it's those kinds of challenges that we face for our work. Those and having when we did the air monitoring, for example, we went and presented and showed the data into CDP chief who gave us the grant for the supplemental, the SCP grant. And even then, we faced a lot of barriers and wanting to know more. And it got to the point of saying, what else do you need in order for you to believe that our community is suffering? And the same with the Environmental Protection Agency. We received the grant, we got the funds, but it's like, oh, wait, before you get that money, you have to do A, B, C, D, and E. And you have to work for it practically for free because the funds that we had allocated for our staff was not enough. So it was capacity building. And it's like, how are we supposed to support our community? How are we supposed to build this climate resilience, community for the future if we can't even get access to those resources, to the funds and language? Language is another one where our community, our city is going through this big Future 2045 plan, comprehensive plan. And the comprehensive plan is only in English. And over 80% of our community speaks primarily Spanish. So that lack of equity, those lack of resources, or having the resources, but they're practically out of reach for our community, has been some of the many challenges that we face in our community, and to making sure that they take advantage of the resources that are out there.
Well, first I want to kind of preface my thoughts with the context that there's still a long way to go. But I think one challenge that we encountered as Kaiser Permanente started to look at moving into this space and community, and again, beyond our footprint, is the climate and health space has, I think, gone from relatively uncrowded to gaining a lot of traction and getting a lot of attention more in recent years. And that's my perception, but somebody definitely correct me if I'm wrong. And so we were really sort of struck by, as we started to look at community health initiatives, we wanted to make sure we were providing support where it was really needed and not duplicating efforts that were already out there, and not continuing to ignore gaps that were persistent, and really not letting the work that needed to get done. And so that really, again, I keep coming back to the work we did with CHI, but there was a lot of motivation in that vein to really take that deeper dive with community. And then even looking at the data and evidence issue, one of the things we started looking at is, okay, can we support research and community-led research in this space, but not even knowing what are the gaps. And so we've continued to engage in initiative, one in particular that's looking at the state of current evidence in climate and health, and where do we have really robust evidence, where is it missing, where is research happening, and where do we need to look at bolstering that with additional studies and support. And so I think, the challenge, it's a challenge and an aspect that there's so much happening in this space, but we really just wanted to trying to be intentional when there's so much urgency is really a challenge, but it's one that we're doing our best to navigate, I think.
Thank you, Lisa. We'll take, Catherine, thank you for joining us. We'll take one last comment on this question.
Yeah. Hey, everyone. Catherine Mulready. I'm with the Colorado Hospital Association. And just in reflecting on the conversation so far, I thought I'd maybe highlight just a couple of barriers that we're seeing. So we represent all the hospitals and health systems all across Colorado. And I think I want to start by just thanking those of you that are doing this very difficult community work. From my perch, we mostly work at the systemic level. But one of the challenges I wanted to highlight today was kind of resource competition, right? And to such a large degree, the work that all of you are doing in community and building that awareness and helping with education, kind of regardless of what
what community you're working for, is helping to alleviate some of that pressure on resource competition, very much to your point, Lisa, that like it's become this burgeoning thing. Because from the hospital's perspective, the health system's perspective probably too, it's, you know, we do have limited resources, everyone does, and can we invest in climate change investments, or do we need to invest in care, or do we need to invest in community, or blah, blah, blah. And so many resource choices. And so that community pressure, for lack of a better, maybe I should find a better term, right? That community will building, I think really does help organizations prioritize it. So if you're feeling disheartened, just know it does make a difference. And then I think maybe in solidarity with some of the community organizers that are feeling disheartened by this, we face systemic barriers too, even as large organizations. And so I was just thinking about a couple, and Megan and I have had some conversations about one of them, which is I've got some rural hospitals that are in plants that are 70 years old. Try first of all, try meeting your like building requirements standards in a 70-year-old building, let alone having a kind of positive net positive contribution to the climate change challenge. And so trying to figure out kind of how do we modernize these entities and get them kind of to be leaders in that. And then the other piece that always comes to mind when I think about kind of the systemic challenges we have, we're organizations that operate 24/7, 365, and everyone needs us to be there and open and contributing to the climate change problem, right? From that perspective, but so much of the supply that flows through our system are single-use plastics and have a very, very significant climate impact. But those are not necessarily choices that we control very much, or if there are alternative formularies or alternative packaging materials, for example, they are often very expensive. And so just kind of acknowledging the competitive nature of the resource challenge, but really wanted to honor the work that all of you are doing at the community level as well.
Well, thank you so much, Catherine, for sharing that, and for everyone for joining our fifth bowl. I'm going to invite you to find a seat back in the audience as we wrap up here. But thank you again for sharing all of your perspectives. And I'd like to leave folks with this question. Hopefully you have learned a little bit about some of the ways in which folks are already working to advance climate resilience. We've heard about some of the barriers, some of the opportunities. We would love for everyone to just kind of reflect after today's session about what are one or two actionable things that you can do to either get more involved in this space if you aren't already, amplify the work that you're doing, make it more visible, partnerships, thinking about the ways that you're creating funding opportunities. What are a few things that you can do stepping away from the session today?
Thanks, Emily. Another round of applause for everyone that participated in the virtual. It's the first time we've done this, so it's cool. I think we had 10 participants. So really cool. Round of applause for Lisa and for Guadalupe as well. Thank you so much for sharing. So in our last, I think we got like 2 minutes exactly. Really quick, how to get involved. So really quick, we have CHI. We put together our first of its kind. It's called Colorado's Health and Climate Policy Agenda. We'll have a link to that on the screen in just a second. QR code for that. We'll have it in the chat as well, and that's available on our website. This was the first of its kind policy agenda. It was informed by an action team that we put together. Big thanks to Denver Foundation and the Rose Community Foundation for funding this work in the last year and for continuing to believe in this work. Philanthropies make a huge difference in this work. You can reach out to us if you're interested. We'll have our emails up on the screen. If you're super interested, you read the policy agenda, you become interested in different areas in it. There's literally an area for any kind of organization in this room. Give it a read, give us a ring. If you're interested, you can become a policy strategy champion. You can join our action team. Happy to talk afterwards if you are interested. And then again, just engage and inquire with the communities that you work with. Ask questions. Try to connect those dots. it's great I really love the fact that Civic and Cultivando are working together. I love that idea that organizations that have different kinds of skills, resources, are connecting with one another to advance this work. And of course, support the work. Resources are needed. So really cool, really quick news you can use. Here's a QR code for our policy agenda. If you haven't taken a look at it already, we will have a link to this up on our website. So this is the report from Kaiser Permanente, Colorado, that CHI worked on with them. Especially if you are working in philanthropy or healthcare, health systems sort of space, this will be a good report for you. But also if you're in a community-based organization doing work in health and environment, this is the right report for you. Today, the state of Colorado has launched its first Colorado Climate Preparedness Roadmap, and CHI has the honor of actually getting to work with the state's Office of Climate Preparedness and Disaster Recovery. I sound very tired because we've been working on this until late last night. So if you see Brian Clark running around, he designed this, give him a hug. So this is out. It will be available online sometime in the next few hours. It may have actually just launched. I think a press release may have just gone out. So this is a roadmap that is geared towards state agencies and sort of the opportunity for Colorado state agencies and governments to make a difference on climate preparedness. And then finally, I know Cultivando is going to have a few reports coming out this spring, so we'll have a link in the chat as well, and we're happy to share more information from Cultivando as well in terms of the work that they are beautifully building. Again, 3 key takeaways. I'm going to put them up on the screen because we're at time, but we want you to all just know that everyone in this room does have a role, and if you need a little help connecting those dots or want to have a conversation, please come see us after the session or feel free to connect with us afterwards. Thank you for your time, for your thoughts, for your generosity, and in being here today. And yeah, again, huge thanks and round of applause for the 3 other speakers. This is our contact information to aggressive in getting in touch. All right. Everyone is dismissed.